Good morning, guys. I hope we're all sparkly. What should we talk about today? Let's talk about how TRT is a fix for life. Because when you get diagnosed with low testosterone, it's often a eureka moment. Finally, I found the cause of my negative symptoms. And the cure is testosterone replacement therapy. Job done. Now, that's not the case. Now, yes, normalizing male androgen levels will help alleviate the negative symptoms that you're experiencing, but it's not a cure for life. So let's first address what caused your low testosterone. Now, if you don't have an organic pathology, it's likely something you've done to create this problem. Now, it could be simply burning the candle at both ends. It could be just being lazy. It could be being a naughty boy, banging in gear, doing lots of recreational drugs, drinking heavily, antidepressants. Now, is it chicken or egg? Did you go to the doctor with depression, or did you go to the doctor with low testosterone and he gave you SSRIs, which cause a functional hypogonadism? Are you popping loads of opiates? Are you a fighter, not a lover? Knocks to the head. Funnily enough, your brain doesn't want to be squished around. So you are going to have pituitary dysregulation as a result of head trauma. So you've got testosterone replacement therapy. This is the cure. No, it's not an important piece of the puzzle, but it is not the cure. Now, normalizing male androgen levels will help allow homeostasis. This wonderful mechanism whereby your physiology maintains a stable internal environment despite external changes. Understanding that these anabolic processes must work with the catabolic processes, etc., etc. But you're not feeling better despite being dialed in. What could be the problem? Well, let's first look to lifestyle. Let's look to sleep. Now, if you haven't seen or read the book Why We Sleep by Matthew Walker, he did a podcast with Joe Rogan, which I strongly recommend you watch, because nobody wants to read anymore. We don't have the concentration span, do we? We're overstimulated. What next? What next? What next? Concentrate on the moment. But sleep, funnily enough, it's pretty important. Now, not only does it help your anabolism, and this is when your testosterone predominantly gets produced, so you have that spike of testosterone in the morning. It's obviously restorative in numerous things. Now, let's consider having a bad night's sleep optimized on testosterone replacement therapy. You're still gonna be tired. Now, let's consider having weeks, months, years of poor sleep. Why? Perhaps psychological stress will address that. Perhaps you have an underlying health condition such as obstructive sleep apnea. Your snoring is causing a decrease in oxygen saturation. So there's no way the normal physiological processes that occur during night will occur. Not only will you be shattered, your health will negatively be affected by having persistent bad sleep. Rest, recover, grow, repair, prepare. So you can be optimized on testosterone replacement therapy and still feel rubbish because you have bad sleep. So what should you do? Sort it out. Go to the doctor, have a sleep study, or arrange one privately, and get on CPAP if you need it. Now, what else causes obstructive sleep apnea? Being a chunky monkey. Now, chunky monkeys have all sorts of other health problems, but obviously when it comes to obstructive sleep apnea, that excess adiposity when you relax and you are supposed to be resting is counterproductive and will occlude your airway. So don't be a chunky monkey. It's not good for you. You don't have to have a ripped physique to be healthy, but you need to have a healthy body weight to allow the natural mechanisms that occur within the body to actually occur. So, stress. We spoke about that in the last video log, didn't we? The psychological stress as opposed to physical stress, and how that is counterproductive and counterintuitive. When we think about our species, we are a physical being, so let's get physical. Do. Exercise, super important. Move. I wake up every day, put my foot to the floor, and my knee hurts. However, it eases with activity. Not only am I moving, the blood supply is getting pumped to my knee to recover, and also synovial fluid is being produced as a result of friction in the joints. So, movement is the cure. What else? Diet. Funnily enough, you are an animal, and if you put artificial crap in your body, it's gonna reject it. The liver detoxifies, metabolizes everything, so do not place unnecessary stress on the liver. Eat real food. Eat a predominantly plant-based diet with some organic meat, oily fish. Yummy, yummy, yummy in my tummy. Now, there's no harm in having a treat day every once in a while, but isn't it funny, when you eat a healthy diet and you have a cheat day, you feel rubbish afterwards. You might have replenished all that glucose in the form of glycogen in your muscles, but you have a big massive insulin dump and you feel groggy, sluggish. It's not actually a nice feeling. So interestingly, we work hard all week to treat ourselves at the weekend to remind ourselves why we need to work hard. How peculiar is that? Now let's take booze as a perfect example. I love a bit of booze, but it doesn't love me. It doesn't love anybody, quite frankly. I've never met anybody that hasn't actually thought, right, I do actually feel better not drinking. Now, whether you go back to it or whether you don't go back to it, nobody ever regrets giving up alcohol. Now, isn't it peculiar? You'll have a sesh Friday, Saturday, feel rubbish Sunday, Monday, Tuesday, Wednesday, and then by the time it gets to Friday, you feel great again, ready to do it again. Or perhaps you try and deal with your psychological stress by decreasing consciousness with this narcotic, which is alcohol. Now you need to work out this psychological stress because, as we've said before, the physiological dysregulation that happens is as a result of psychological stress. In a lot of cases, it's unresolved physiology. Our brains need to work this stuff out. And if you don't allow your brain enough chance or adequate time to work it out, it ain't going to work it out. Now, you will need support sometimes. It's good to talk. It really is good to talk, because isolation, bottling it all up inside, funnily enough, doesn't actually do you any favors. You create more and more psychological stress that manifests itself as a physiological problem. Sort it out. It is good to talk. A problem shared is a problem halved. Exercise. Again, we've spoken about that in detail. Exercise according to your physiology, whether you're predominantly type 1, type 2A, type 2B. Train, 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 train. Exercise is the best antidepressant available. Exercise in nature is even more effective. You should be physically active every day. Well, I don't like exercise. Are you depressed? Yes. Go exercise. There has never, ever, ever been a situation where I've exercised and not felt better afterwards. Never, ever, ever. So get up off your ass. Go hunt. Go gather. Because if life is about anything, it's about moving forwards. Testosterone is super important. It gives you the ability to move forwards. However, it is still your conscious decision to choose positivity over negativity and get up off your ass. Because the satisfaction that you get from doing compared to not doing is far greater. You know it, I know it. The most successful people are busy bees. I've already been to clinic. I've already walked the dogs. I'm going to go home and do my HIIT.